Hi, everyone. This is Yehudis Schamroth, RBS Acupuncture, the nurse that does acupuncture in Ramat Beit Shemesh, Israel. Today's health topic is a mental health topic, something that needs a lot of conversation and a lot of to repair work to do, as I understand it. But it's a topic that is adolescent health, to be specific, and mental health, adolescent mental health, to be even more specific. I have a special guest with us today, Dr. Goldfred, who is a pharmacist. She has a lot of dealings with young people and has had occasion to not witness, but be a part of understanding the workings behind families whose children committed suicide, unfortunately, in very low Elena, we say in the Jewish world, a real tragedy. And it's the kind of thing that we want to talk about now and try to work on how we can make things better for our kids in every way, not just physically, not just going organic. We need to work on their mental health as well. And despite the multiple challenges that children have these days, today's generation of young adults is one of which we can really be proud. Already, they are adapting to a world that is transforming rapidly all around them, exhibiting a growing sense of community and responsibility and a sincere desire to make the world a better, fairer place, just like I hope the rest of us were when we were growing up. They're very idealistic, which is wonderful. In doing so, they're demonstrating remarkable degree of creativity and innovation. It's seen as there's teen projects happening all over the world for everything from green planet to politics to health care. It's a wonderful thing to see. But this generation is also facing a unique challenge in the form of an unprecedented mental health crisis. And it is clear that it is a younger generation that is under the most enormous strain of all of us and in need of great support. And it's essential that we give urgent attention to this. And how can we tackle mental health epidemic amongst young people by increasing the efficacy and support that we can offer them, both at school, in the government, in the home. We have to tackle it from all ways. We do know that in most countries, Britain, the US, and Israel, teenage mental health is in a crisis. And the COVID-19, a pandemic year, has only intensified this crisis. And everyone needs to know that they are not alone. So we have to find ways to let these teens know this. We have to let them know that people understand what they're going through and that there's someone to call who cares. And the one thing that really hits home, though, is the high rates of suicide, especially teen suicide has been happening and gradually increasing over the 20 years of a study done in the United States. For the last 20 years, just under 800,000 people, not teens, but people, took their lives by suicide. And there is a stigma about mental health. We still know that. People are still very reluctant to talk about it. People are a little ashamed. People really want to brush it under the carpet. We're hoping this time goes on quickly, that we'll be able to start conversations about this and really make them meaningful and get people very, very involved with preventing any kind of problems like this. Any suicides is such tragedy when anyone loses their life, especially a young person with their whole lives ahead of them. I remember a rabbi saying, Rabbi Zeb Leff, he said, when kids get into drug abuse, I'm not sure everybody agrees with this, but it kind of resonated with me. He said someone was asleep at the wheel. So what does that mean? That means somebody was not paying attention to this kid who was in a lot of pain. And now I come from a community where people have several children a lot of times. Not everybody. I have 3. Baruch Hashem, thank God. But people have 8 and 9, 10 children. So how do you find that time to pay attention to the little boy who was maybe being bullied and he comes home crying, or some kid that starts wetting their pants all of a sudden and you don't even know maybe if they've been abused or touched in some inappropriate way, or some teenage girl who's being harassed or being bullied by her peers. If she comes home in bad moods, or if the kids don't want to go to school in the morning, or there's subtle changes in behavior. So what Rabbi Leff said is it kind of, like I said, it resonates with me. I feel like if people could pay attention to what's going on with their kids, they would notice changes in behavior, emotions, and things like that. But it's not always necessarily true. I mean, there are kids that put up with a whole lot of things, and they never tell their parents. And the parents say, please talk to me. Please tell me what's going on with you. And the kids just are afraid, they're ashamed. It's a whole thing. We can make many different discussions on it. So we just have to make sure we're there and open for our kids. So this is a stigma of mental health that was still with us. People are embarrassed. People would much rather have a broken leg or even cancer, God forbid, than have any kind of mental illness in their family. And we do know that during Corona too, the calls all over the world went up like over 300%. That's coming from the suicide and other kind of hotlines that had to do with mental health and abuse, physical abuse, sexual abuse, spousal abuse, stuff like that. Okay, some of the key facts, and we know that 1 in 6 people are aged 10 to 19 years old. Mental health conditions account for about 16% of the global burden of disease and injury in people aged 10 to 19. Half of all mental health conditions start by 14 years of age, but of most cases are undetected and untreated for the reasons I mentioned. Kids are ashamed to talk. They don't think they can tell, they have anybody to share with. Sometimes the parents do invite the children to speak, but they don't give the body language that they're available. There's a lot of different reasons why kids won't share what's going on with them. We also know that suicide is the 4th leading cause of death in 15 to 19-year-olds. So let that sink in for a minute. 15 to 19-year-olds, 4th leading cause of death. It's unbelievable. The consequences of not addressing adolescent mental health conditions extend to adulthood, impairing both physical and mental health and limiting opportunities to leading fulfilling lives as adults. And we did a session last week, a podcast last week about marijuana consumption and usage as an exit drug from getting off of opioids. So, of course, where do these children want to go for help and just to blur their minds and self-medicate? They go to opioids and all kinds of street drugs, and this is where a lot of the abuse, drug abuse begins. It's not just peer pressure. Adolescence is a unique and informative time, and multiple physical, emotional, and social changes, including exposure to poverty, abuse, and violence, can make adolescents vulnerable to mental health problems. Promoting psychological well-being and protecting adolescents from adverse experiences and risk factors that might impact their potential to thrive are critical for their well-being during adolescence and for their physical and mental health in adulthood. So we know it's a crucial period for developing social and emotional habits and developing a good mental well-being. What we need to teach our children, and we'll talk about in another session, would be how to problem solve with them, how to convince them to have good sleep patterns, good eating, and regular exercise, teaching them coping skills. This has to be done in the schools and in the homes, in family and school and wider community as well. This would be a very beneficial. It's underestimated how beneficial just talking to a kid and giving them some life skills can do. Gone are the days where kids in high school were taking home ec courses and things like that. But I think it's one of these things that making kids and teaching them to be competent adults also really improves their self-esteem. So these are another ways we can decrease the risk of kids being at risk or kids being depressed. If they have a mental illness, it's a different story, which I'll address. So multiple factors will determine a mental health diagnosis. And I don't have this is out of the purview of this kind of discussion here to how we would determine this, but getting a good evaluation by a psychologist or psychiatrist, or talking to some religious person who may have good advice for you, like your rabbi or your priest. Children are so vulnerable to things that if they already have a mental health disorder, that anything like sexual violence will clearly tip them over the edge. And we have to be ready to help them with anything. We do know that mental health a lot of times is hereditary. So we have to be careful. We have to be on the lookout for kids who come from families with mental health issues. And we have to be ready for them and help them, prepare them for what they need to go through in life with that kind of illness. And again, stigma has to be removed. We have to be able to talk about it. We have to provide services. We do know these kids are very vulnerable to social exclusion, discrimination, and stigma. And they're really very reluctant to seek help. Or maybe they don't think anybody cares enough to help. And then there are, of course, the educational difficulties that come from this, the risk-taking behaviors, and the physical ill health, and other human rights violations, possibly. So we do know emotional disorders commonly emerge during adolescence, and in addition to depression or anxiety, adolescents with emotional disorders can also experience excessive irritability. So that could be frustration and anger, and these could be red flags already. So if a kid, again, has a change in personality, it's something to really, really pay attention to and get an evaluation with somebody very respected and very competent. Globally, depression is the 4th leading cause of illness in the same age group of 15 to 19. Anxiety is the 9th leading cause of illness for adolescents in the same age group. We're talking 15 to 19. Emotional disorders can profoundly affect areas like schoolwork, school attendance, can create social withdrawal, and it can exacerbate isolation and loneliness. And of course, as we just mentioned, at its worst, depression can lead to suicide, God forbid. So childhood behavioral disorders. Okay, just to mention about this before we get to our guest, I'm just going an overview of teen mental illness as we know about it now. And there's so much more to discuss. This is just the tip of the iceberg. I wouldn't claim to make this a mental health, a stop for all information on mental health for teens, but we're just opening the discussion here. Child behavioral disorders are the second leading cause of disease also. So children can have other diseases too, because if they're not taking care of themselves, they're not sleeping, they're not eating right, they have anorexia, they can develop other illnesses as well. And they find themselves in and out of the doctor's offices, in and out of the hospitals even. And even then to another situation that if they're feeling very desperate, if they don't have ill health, these behavioral disorders can result in criminal behavior even. They might start stealing or acting out in some way that's violent. So eating disorder, let me just say about eating disorders for a second. They commonly emerge during adolescence as well and young adulthood. And eating disorders affect females more than males. And conditions such as anorexia nervosa, bulimia nervosa, and binge eating are characterized by harmful eating behaviors. And like they restrict their calories, as we know, in binge eating, they make themselves vomit. And this, of course, this causes terrible, terrible health problems, not just the lack of growth and development. That's the minimum that would happen, but they can end up with liver and kidney and diseases and heart disease as well. There's a mention on psychosis in this journal that I've been reading, and it gives the overview. Conditions that include symptoms of psychosis most commonly emerge in late adolescence or early adulthood. So symptoms can include hallucinations or delusions. So these experiences can impair their ability to participate in daily life and education and good decision making, obviously. So mental health for teens is a range of things, anything from anxiety, which can really be handled and treated very easily if detected, to the severe, of which is psychosis, suicide, and self-harm, which is the other extreme. And we want to try to prevent any of that, whether the child does have a mental health history or not. It will lead to a mental health history if it's not addressed in early stages. So we do know that a lot of kids self-harm. Suicide is, of course, the third leading cause of death in older adolescents. And this article, this is from the Journal of Mental Health from Harvard. Nearly 90% of the world's adolescents live in lower middle income countries. They are the ones with the highest risks. So it's a multifaceted situation. It can include much more harmful behavior, like I mentioned, drug abuse, alcohol abuse, stigma against being detected, being treated, communicating what their needs might be. And of course, the risk-taking behaviors can take over their lives too. And they smoke and they drink and they do all kinds of things. Kids do that anyway. On a good day, you will find teenagers just doing that anyway as a means of socializing and escape. But really, when it gets out of control, this is where it can lead to terrible things like suicide. So promotion and prevention, we're going to talk about that in a minute. Mental health promotion and prevention interventions aim to strengthen the individual's capacity to regulate emotions, enhance alternatives to risk-taking behaviors, and build resilience for difficult situations. So much of this is preventative, early detection, and treatment. So it's really crucial to address the needs of adolescents with defined mental health conditions and avoiding institutionalization and over-medication, which is something that cannot be emphasized too much. People don't know what to do with these kids, so they throw them in institutions, and they've been doing multiple studies recently that everywhere from Britain to America to Israel and other countries, what's so-called civilized countries, these places where kids are sent to for rehabilitation or treatment are just antiquated at best and very dangerous, at the worst. They can take their own lives and not even be supervised. They can have, without supervision, kids will do everything they would do at home in these institutions. It's impossible to know that could happen, but it does. So this is the post-millennial generation, and it's very uniquely qualified to make good futures for themselves, but we have to help them. We have to set the right environment for them. We have this explosion of innovation and opportunities for all ages to succeed. So let's get busy and let's do it from a society point of view, from a government point of view. Let's start the discussion right now with Tanya Goldfred, who is a dear friend of mine in here in Ramat Beit Shemesh. She is a registered pharmacist, and she's a teen mental health advocate. I invited her on because I want her to share her reason for getting involved in this particular topic, in this particular theme of her life. She's a master's in public health also, and she's a pharmacist. Why would a woman like this be so involved in teen mental health? She will explain to us that her experience tells her that she's witnessed multiple medications given over and over to kids for mental health issues without even knowing why or how, and the kids become worse very often. And she has gotten involved in suicide survivors and researching the data on that and interviewing people. And she's come to a conclusion that these kids, if are detected early enough, can really live wonderful, productive lives and never ever end up in a situation like that. She doesn't know, but no child should. She started a website that I urge you to look at. It's called www.teenstriumph.org. Now, Tanya is also hosting a summit, a teen mental health summit. She likes to call her goal Teens Triumph, because she wants it to be a positive thing. She wants a goal to be triumph for the teenagers. If you look at the sidebar, I have her website and also her summit information. The summit will take place from November 14th to 17th. That's coming up in a few days to 2021. You can get a free ticket. You have to register online. It's a 4-day summit. You don't have to see all the days, but you might want to take a look at the speakers, the lineup of the speakers and their topics, and you can book in on that one day. So I looked at the website. It's a beautiful website. It's very upbeat and positive, and gives lots and lots of ideas for people to help their teens or help people who they know struggling teens. So it's an opportunity to hear from therapists, educators, counselors, coaches, and healthcare professionals from all over the world. So Tanya has organized all these people from all over the world. They give really good advice on how to get your kids to navigate these crucial years very successfully. And they focus on giving parents skills. So this is not a summit for children. This is a summit for the parents. And it should inspire all of us to take the incremental steps needed to empower our teens and to leave us with the point-by-point skills to be confident in doing that too. Because we're not taught how to take care of kids that often, whether it's changing the diapers. Some people are naturals, but some people can do physical care way more than emotional care. I kind of came from a family like that myself. My father was a good caretaker, but emotionally we couldn't really, be helpful to each other. He couldn't be helpful to me when I needed it. It's just the way it was. He wasn't even that approachable on that level. So people are not prepared, and they have bad experiences, the bad upbringings themselves, and they carry it on to another generation, as you know. So without further ado, I'm going to invite Tanya. It's a pre-recorded interview, and please look at the sidebar. Contact Tanya through www.teenstriumph.org. Go to the summit, November 14th, 17th, any day you want. There's 4 days. Go to all 4 days. It doesn't cost you anything. And you can get that at the same website, www.teenstriumph.org. You can reach Tanya that way if you need to speak to her privately. Thank you very much. And we're trying. Okay, not playing. Let's see. Hold on, everybody. Got a technical difficulty.
For everybody.
Oh, well, thank you for doing so. I do what I can. Hashem, God bless me with a lot of energy, so I'm trying to use it in the right ways. But thank you for noticing.
You always do. It's always amazing.
Thank you.
Very inspiring all the time, Yehudis.
Thanks. So tell us about what you're doing here. What kind of project? And I know you have a special event coming, so we want to hear how you got involved in helping teens and worrying about teens and taking care of teens and their mental health and helping parents. So tell us how you got involved in all that and what your organization is. And just you go ahead and talk, and I'll ask a couple questions here and there. You have the floor.
Okay. So I guess it started because I am a mother, an aunt, and I am a community pharmacist. So I hear about I've heard about a number of different problems people have. I've been involved with some of them. Mental health, let's take a step back for a second. When somebody knows that you are hurt, when somebody knows you have an illness that they can visibly see, they can be concerned, they can understand, And we assume that somebody's sick. Okay, they're sick, and we can feel for them. Mental illness, we are still too stigmatized, and it's a problem. It's a problem because it's an illness, just like I have asthma, just like somebody else has heart disease. It's an illness. Some illnesses we can prevent. Some illnesses we can make be a little bit less extreme. But all of them are still illnesses, and they don't need the requirement of being a taboo. And in many parts of society across the world, it's a very large taboo. The problem is that in the past 10 years, we've had an enormous spike, even before Corona, in teen suicide. I've gone through a number of things personally throughout my life. I would like to say that my life was never smooth. And I guess I always knew in the back of my mind that suicide was not an option. And it came from two reasons. It came from both faith and my father. Faith, because everybody was put here. I was always indoctrinated for a reason. And when the Almighty wants you to do something, he gives you things to do, and you have to overcome them. But that's not always enough. We also need role models. And I was very fortunate. I had Superman for a dad. My father is a child survivor of Birkenau and Flossenburg and Gleiwitz too. And anytime I found myself in this tremendous amount of pain, even if it would like be a glimmer of your thinking, you're so depressed, you're so upset that you were thinking about ending it all, I would say, what, are you an idiot? Look at everything he went through. And even when it was over, he didn't have it smooth, just so you know. And he's never even thought of it. It wasn't even something that was part of his vernacular. So it wasn't something I would have been allowing myself to do. And each time I hear about another young life that was prematurely ended, even if it's just a car accident, it breaks my heart. Because that's families and their hopes and dreams that, never came to fruition. And who knows? So I was in school, working on my master's, and one of my things is I'm a diabetic educator. I run these programs every so often. 2 teens within a period of 2 days in my small town committed suicide. One was a boy, one was a girl. It wasn't a Romeo and Juliet thing.
I remember.
And they were both coming from good families, but there was a lot of pain involved in their lives, and there was a lot of illness. And it was very, very heartbreaking, because as a person who works in the healthcare field, we also go into it usually because we think we're going to help and we're going to make a difference. And when something like that happens, you feel like I didn't do enough. And that was basically the feeling I had. And we had to prepare a presentation that day of what we wanted to do in media and things like that to help promote health. And I was supposed to be doing diabetes, and I switched it. I built a program for high school teenage girls that I wanted to get into the high schools on how to feel good about themselves, how to build resilience, so that they won't ever, God forbid, all these things happen when people are not resilient. They give up easily. They don't push themselves forward. They can be easily battered wives, all these things we don't want for our children. And I wanted to work on that. And I built a beautiful program as far as I was concerned. And then Corona hit. So we didn't have schools. And obviously you couldn't get into the programs. So I put it online. I'm promoting it now online. I have a teen resilience program. But then, when you're working a little bit in the field, you see all these other components, all these other issues that keep coming up. And so I wanted to brainstorm with other people who are working in the field and get some more information out there that people might not know. I'm a pharmacist, but I don't like people taking medicine. I got to be honest. I'd rather you come in and talk to me about your vitamin needs, and I can help you. I'd rather de-prescribe when you have too many medications. I'd rather get you off of some. So,
and I feel the same way with Chinese medicine. And every week I would have an occasion to say the best medicine is no medicine. Really, if you try to work towards, some people have to, like you have to take your insulin, you have to take your antibiotics if you have strep throat. Of course, that's what they're there for, to help us, to heal us. But we do know that people are over medicated, and they're medicating themselves as well. Last week I did my program. It was on marijuana and how people, are sort of are addicted, attracted, so on. But that's another topic. But I'm just saying, I know what you're saying. It's really better to, you can't be with no medicine all the time, but you try not to overload. Yeah.
And you have to be responsible. Like some people think, like you said, diabetic medications, and this is one of my things because it makes me crazy. They come in
again on that
and
topic.
they tell the doctor they're not doing any better. And so he adds another medicine, but they're not doing what they need to do. They're not following their diet. They're not doing any more exercise. Come on, guys. You want to get better, or you want popping a pill is not the solution for anything in most cases. So the idea came up. And I reached out to a bunch of people. And I think every single person that I reached out to, and you should know, Yehudis, these are people who they make money. They don't come cheap. They all donated their time and their expertise to this project, because anybody who's involved in it, I think you're on mute, Yehudis. I can't hear you. Anybody who's involved in this project, in this field, knows that we're at a crisis. Corona, we were in crisis mode before Corona, and Corona just made it worse. And they were all willing to sit down and share some of their wisdom and work with me on this. And it was beautiful. It was really heartwarming. I have people who are experienced in the field from all over the world. I have 2 people from Australia. I mean, just coordinating, speaking with one of them, it was a whole to-do. I didn't know there were so many time zones in Australia.
Can you hear me now? Can you hear me?
I'm sorry?
Can you hear me now?
Yes.
Okay. So what I
can hear you now.
I want to ask you, what is your organization? And tell us about this summit that you're putting together. Which inspired you to reach out to all these people? Like, what are we going to look forward to? And we're going to advertise it for you.
Okay, so it's called, we were looking for a good name that was positive, a positive spin. So we said teentriumphant.org, because we're going to make teens triumph over things. So the organization, that's the organization right now. That's it. The summit itself is a 4-day virtual event that you can watch from the comfort of your own home. It's free. If you want to own them, there is an option, but that you have to pay for, obviously. But each day we're going to be uploading for 24 hours that day's presenters for free. And then, like a pumpkin, they go poof at the time is over. And we have the next day goes online. So let's see. The first day, we're going to be discussing what I like to call the basics, the building essentials. So we're going to be touching on food, movement, and sleep. 3 things. All right. So I have a world-class athlete speaking. I have a technical writer who decided, when her life was very busy and complicated with a bunch of kids and working hard, that she was going to start running, even though she was, like, for all purposes, a couch potato. And not that she was heavy, but just she wasn't very active. And she's been running marathons, and now she is a trainer, and she's still a technical writer, and it's very cute. I think you're on mute again. Who else do we have? I'm speaking about food. Somebody who had a very crazy illness, that she was fatigued for like 15 years, and she completely changed all of her food using a different system of protocols called medical medium or something. I forget what it's called. Medium. It's in the summit. She changed all of her food, and she's beautiful, healthy, vibrant. And then I have another thing on sleep, because everybody's busy, everybody's super this, but they discount their sleep, which is essential for healing and functioning. The day after that, we get down into some of the nitty gritties. We have somebody talking about communicating with your teen, somebody talking about building a relationship with your teen and how to avoid substance abuse. I have a very, very interesting person who was working with Native Americans in the far reaches of Canada. And he was telling me that there are these remote areas of Canada that the suicide rate is 3 times higher than anywhere else in the world. And he was working as a suicide and life coach there. I didn't say that right. He wasn't a suicide coach. He was he was trying to prevent suicide.
I knew what you meant, though. I was shaking my head, yeah. But you know, because I can tell you with Native Americans,
Yeah, right.
in Native Americans in America and in Canada, their whole culture has been, you know, taken away from them for so long, and they really don't have much to live for. And I knew about the alcoholism. You know, we learned this back in my school days.
Right. I remember that.
They're the highest.
But I didn't know 3 times the amount. That's heartbreaking.
So terrible, yeah.
And he said it wasn't all Native Americans, though. He did say that when I was talking to him privately, he told me that it was anybody who lives in those remote areas, even some people in North Dakota, which, you know, that's you don't expect these things in beautiful Canada or United States. It just shouldn't be. Let's see. I know I'm forgetting some people. We have literally 18 different speakers, but there's more than that because I think there's more than that as far as topics because I speak like 2 or 3 times. The next day we have somebody. Oh, so this is a fun one. The next day, you know, you remember when you had teenage girls? Sometimes the problem is just the way they feel about themselves, how they look, even though they're gorgeous. So we have somebody who's going to be talking to us about body image because she's a stylist. We have somebody who's talking about self-esteem and building self-esteem. We have somebody who's talking about, we always hear all the bad things about the digital social media impact, and there is truth to some of it, but like everything else in life, like even cell phones, you can be addicted to your cell phone, but some people use it for lots of good things like you do. You know what I'm saying? So somebody's going to be talking to us about the possibilities of the digital age for mental health, because he's done beautiful things with that. I know I'm forgetting things.
That's okay, because we're gonna publicize. You're gonna send me the outline and the links and everything else. So
whoever signs up, we have whoever signs up on the summit page itself. It sends pictures of everybody and what they're talking about. Except for mine, it doesn't say what everything I'm talking about, but that's okay. I'll surprise you. And then when you get into it, one of the days before the summit, we send out the whole schedule because it could be there's certain topics that some people don't want to hear about, which is fine. You don't have to, but there are certain topics that you might want to schedule that you make sure. I might not be able to get to everything, and like unless you pay for the VIP, you don't. But you say this is important to me, so you're going to make sure you have 45 minutes or an hour set aside that you can listen to it. The only thing I would tell people is that it isn't for the children; it's for parents. Okay, this is where parents are taking proactive steps to become the best parents they can be to help their child. It's not something that we're going to sit down and watch with our children.
Okay. So let me ask you, how many people will be interviewed a day? Is it like 1 hour a day, 2 hours a day? What is it?
No, that's the thing. I have, on most days, I have between 4 and 5 speakers.
Yeah.
Most of them, I think, spoke for a half an hour tops. Like most of mine, I know are about a half an hour, 30 minutes. I did have some people who went over. Like I have somebody, I think he might have been an hour or so. I have a few people who went an hour or so. The last day is the fun day when we're focusing more on changing parental guilt, because, you know, I know for myself, like one of the things when you learn something new that you could have done differently, especially when you're impacting somebody else's life, you feel, oh, I screwed it up or whatever. So one of our speakers, that's all she speaks about is removing parental guilt. And then we're going to deal with another thing that I learned about that I never knew before when I was in my master's program, which is there's something called social connections that build community. And it's very important, not just for getting somewhere in the future. It's very important for the long-term health and well-being. And they've done studies. There's a Robert Putnam, a big professor at Harvard, who he's done a lot of work in the field. They've clearly shown that the more social networks you have, the longer and healthier life is going to be.
So much sense.
Makes so much sense, though. Yeah. But we have to do that for our own selves, but we most certainly have to make sure that our children don't feel like that. And I'll be honest, this is one thing, that particular issue is one thing that is very striking in all those people who make Aliyah. Because when people make Aliyah, what's happening in most cases is they're going from a place where they had connections, where they had family, and they have to start over. Yeah. And anytime you're starting over and you're missing some of those pieces, because there's certain things that you only can find from family. For example, sometimes if I don't like how one of my children is speaking, or let's say dressed, and if it's a teenager, you know, there's only so many times you can have the same discussion with them. But one little discussion from an auntie sometimes is very powerful. And I know because I've done it myself as an aunt. You understand? So that is something that, and if you don't have your family nearby, which many people who've made Aliyah don't, this is a big thing.
Or somebody who takes an interest in you. I just want to explain that there are some people who are not Jewish that watch the show and they don't live in Israel. So I want to explain that making Aliyah means moving your whole self, your whole family, or even by yourself, but people move from wherever they are in the world to live in Israel. And it can be very isolating at times and very difficult. Forget the language and all the bureaucracy. We know that we have a lot of difficulties, people adjusting here because, like you said, they lose their network and they lose their connections. And regarding that issue too, when I was a kid, I remember there were a few women, they weren't even my aunties, but they would, they took an interest in me, you know? And I remember that always. They asked me how was school or what was I interested in or who knows, whatever. It's like they care, like, are you talking to me because I feel like I'm not even your niece or your child? And I remember that, and I kept it in my mind always to always be kind to children and kids who look like they need to be spoken to, because it went such a long way with me. And I felt and I know that I can make it. I was a Girl Scout leader for a while too, and I know that these girls loved me. They love me till today, and they're married with children because I was like their mother, but I wasn't their mother. You know, and I was enough like their mother that if I wanted to talk to them about the way they were dressing, or whether they were doing something that wasn't appropriate, I could tell them in a kind and good way, and they would listen to me or not, but they weren't offended, and we didn't have fights because it's too emotional coming from the parents a lot of times.
It's true. There's some, and honestly, that same comment about people who make Aliyah, that applies to anybody who, even if they've been furloughed or they're sent overseas for military, anybody who takes a job and transferred, absolutely. It's the same problem, because each time you're transplanting yourself, you're losing some. We have that lots of studies with people who migrate because they lose where they were in society. So unless you build where you are links in your community, and unless you make sure that your children see those links and experience those links, we have a problem. Plus, we have another problem today, because it used to be, I know as a child, there was a neighbor who was always friendly with me. Okay. Today, that wouldn't have been allowed to go on because we're worried about too much sexual assault and molestation, which is a completely real topic.
Oh, yeah.
But all these things, put us like further and further disconnecting us from people, which is a problem for people in a community, because we by nature, and it's not nice to say, we're herd animals. We like being part of a group at some level because we like feeling that we're connected. So one of our speakers, she actually is a PhD, Tracy Bauer, very, very interesting, very well received. She's written for Forbes. She has a number of books. It's very interesting. The people who I reached out to and they agreed, and I'm still don't believe. I'm really in disbelief about all the nice things that have happened. I feel like the Almighty was helping me with the project. I really do, because despite me being a technological disaster, I think it might come off.
Well, listen, I wish you all the best with this, and I'm so impressed with you, and I'm so proud of you for taking the bull by the horns, and you saw some of the need in the community, and you're filling it, and you're working on it, and we're so grateful to have people like you who will step up and help us do things, especially taking care of our teens. They're our future, they're our children,
Yes.
and they need so much care and attention now more than ever. And I understand. I would never do this, but I would hear people say, "I can't bring children." Secular people. We're not, religious people. We're always having kids, but secular people who friends of mine who say, "I'm not going to bring children into this world. I'm just not. It's just too terrible of a world." It's true. The world can be bad, but we are bringing children into the world, and if we have to take that responsibility to move with the changes and reach out for when we need help. And I'm really, really grateful that you have this project going, and I want to try to support you as much as I can and pass the word around. So you will, after we're done here, you're gonna send me all the details that I can put in the sidebar tomorrow or whenever people are listening, but they will be able to see all your links and you have a good website up there that people can look at and read about it and stuff. Great. Tanya, I still want to nab you for some exercise, so we got to get that together in your free time.
We'll start walking again. We have to get it part of our diabetes prevention program.
Okay. And I really, really thank you so much. And you're amazing. And
Thank you.
if anybody wants to reach out to Tanya, I'm going to send her details. It's probably on the website anyway, but I'll give you her email, and you can contact her with any specific private questions you might have for her. And then you can attend the summit. Please attend the summit and pass it around to everybody. So thank you so much, Tanya.
Thank you so much.
All right, all the best. Have a great time. And Tanya is on vacation with her kids in Eilat, Israel. So good for her. Whoop whoop. Have fun. Enjoy. That's what a good mother would do, right? So you continue, and she stopped for just a minute to help me, and I appreciate that too. All right, good luck with the summit. Good luck with the summit.
Thank you
for everything.
Thank you so much.
Okay, that's it. Thank you, Tanya, for joining me. That was so informative, and good luck with your summit. Everybody who's interested in the summit, please look in the sidebar here. You want to go to the website, www.teenstriumph.org, to get tickets. You have to register for a 4-day summit on teen mental health and empowering kids, teaching them resilience and resistance and everything else, and health coaching and everything else you can do to help your child in trouble or before they get into trouble. Thanks, everybody, and we'll see you next week. Have a wonderful one.